Hello, and welcome to this episode in our series on neurodevelopmental disorders. We have been talking about a particular disease called as autism. Autism, as you all know, is seen mainly during childhood, but when the child with autism or another disorder called as intellectual disability disorder grows into an adolescent, it brings about new set of challenges for the parents who are taking care of such children. This episode will deal with some of the concerns and additional challenges faced by parents of children who have autism or intellectual disability. Come, let us meet our expert.
Parents know their child very well, they know their child the best. They understand how the child communicates, how to respond to their needs, and families usually adapt to the needs of the child. But adolescence is a completely different phase. That there are a lot of things that are going on. There are many transitions, new changes that the child experiences, new changes that the family also experiences. During this phase, many children with autism or intellectual disability can have additional concerns that come up. For example, they can have new behavioral problems that was not seen earlier. Sometimes they may have emotional symptoms like episodes of crying, episodes of feeling very anxious, or suddenly having meltdowns, sometimes also leading up to aggression. The next aspect is regarding emerging sexuality. Adolescence is a phase where most of us experience sexual needs, and there are different ways that one expresses the sexual needs. Similarly, children with autism and intellectual disability also have sexual needs, and they express them in different ways. Apart from that, the other concerns are parents often have questions about what are the next steps. Like, now my child is finishing schooling, or my child is coming to the last few years in special school. What should be the next steps? What are the other things that I'll have to start planning for my child? These are some of the common concerns that come up during the phase of adolescence. So during adolescence, there are a lot of transitions that are going on and a lot of new changes that is happening in the child's life. During this phase, any child who is transitioning to adolescence is at a risk for depression or anxiety or any other mental health conditions. Similarly, children with autism or intellectual disability are also at risk for developing these conditions, or sometimes they are at a higher risk as well. There are ways to understand if the child is having any additional mental health concerns apart from autism or intellectual disability that's always been there in the background. For example, there may be sudden changes in the way that the child is functioning, like there are sudden changes in their academic participation or academic engagement. There may be changes in their sleep. They may have difficulties in staying asleep or waking up very early, or frequent awakenings through the night. There may be sudden concerns like being very fearful or very anxious, or having a lot of crying spells, or sometimes some of the behaviors that were noticed earlier, like some of the stereotypies or repeated behaviors, can also go up. A lot of these are signs and symptoms of a new onset mental health condition, which can be diagnosed, which can be understood and treated. These signs and symptoms can be indications of a new onset mental health problem like depression or anxiety or OCD, which has to be understood in detail and diagnosed. New onset problems are definitely treatable. It is important that we understand the problem well before proceeding with treatment. Many times children with autism or intellectual disability may not be able to communicate how they are feeling, what are their experiences, what are the triggers that are leading to some of these symptoms. It's important that we understand and observe them in multiple situations, understand these problems in great detail, and plan the treatment accordingly. There are various treatments that could be helpful. For example, some conditions can get better with medications, some conditions can get better with the way that we modify things in the environment, or for some conditions there are psychotherapeutic treatments. The mode of treatment will depend on how severe the symptoms are, how recent the symptoms are, how much it is impairing the child's functioning, and also how the child is able to engage and participate in different modes of treatment. Oftentimes a combination of these treatments are used and they are found to be very helpful.
This concludes our episode regarding adolescents with autism and intellectual disability. We understood what are the common concerns faced by parents of children who have autism or intellectual disability, what are the new symptoms and how they can be addressed. We'll be back with our next episode. Namaste.